I've only tried non-surgical treatment options. I've tried 4 different anticonvulsants that didn't provide me any pain relief. I've tried acupuncture, which helped in the beginning, but doesn't help anymore. I've tried physical therapy that excruciated the pain. And I'm now doing upper cervical chiropractic treatment, which helps a little.
Ron said, I have been on most medications at some point. Currently, I am on 3 different anti-seizure medications, an antidepressant that works on nerve pain, a muscle relaxer that works on nerve pain. I get infusions of medications that help with nerve pain and take opioids as needed. I've tried upper cervical chiropractic. That made it worse. I've also tried acupuncture, and that gave me short-term relief. Nikki said, non-surgical treatments for me have been about the same outcome as the steroids. I have tried acupuncture, homeopathy, microdosing edibles with little to no improvements. Marijuana is the closest I have come to relieving the pain level and reducing it. However, it doesn't go away. I recently just started acupuncture again, as I am desperate for some way to relieve the aching and stabbing pains. So far, I am not too sure if it is doing anything quite yet, but I've committed to going 3 times a week for now. Eve said, I was put on gabapentin and oxcarbazepine and Percocet. Medications worked for a while for me, but then stopped working. After MVD, I was put on baclofen and gabapentin because with GPN, it also tends to give you muscle spasms in your neck, which triggers headaches. Teresa said, I am 20 days post-MVD and have not had TN pain. Carbamazepine would control it, but during a flare-up, nothing helped. CBD would take the edge off. Erin said, I have had success with 2 medications and an alternative medication that I will just call butter. But I need to be clear. I'm calling it a success because I can still be a semi-functioning human being, but I am still in pain every day of my life. The only thing the drugs do is help curb it to the point where I can grocery shop, take care of my dogs, and barely get through work.
My experience with medication and non-surgical treatments has been a bit of a tumultuous one. While the medications typically helped with my pain, the side effects were intense and I couldn't tolerate or was allergic to most of the medication. I have had my skin blister and peel. I've dealt with drowsiness and fatigue so bad that I couldn't even get out of bed, brain fog, memory and concentration issues, tremors, double vision, headaches, insomnia, gaining and losing weight rapidly, suicidal ideation. My body just didn't handle the meds well. It's kind of like one of those TV commercials where they list the medication side effects. Yeah. At my worst point before my surgery, I had to get a port implanted in my chest because I was needing weekly anticonvulsant infusions just to be able to eat and speak and have a quality of life. I developed serotonin syndrome due to the medication in 2019, which was the scariest thing I've ever been through. For me, the hardest thing with medication is that I think too many people have to decide between having really intense side effects or really intense pain. I think it's hard to find a balance and hard to make that choice in general. Besides medication, I have tried chiropractic, yoga and exercise, medicinal marijuana, Botox, nerve blocks, praying and bargaining, supplements, you name it, I've probably tried it. But you get to a point where you're just so desperate for relief that you'll do anything.
Ken said the doctor prescribed carbamazepine. About a half an hour after taking the medication, the pain went away. Previously, every time I went and got a tooth pulled, the freezing stopped the pain temporarily. I tried acupuncture and chiropractic to no avail. Eventually, I weaned off carbamazepine and started Tegretol for flare-ups. Ashton said, aside from anticonvulsants, the treatment that has helped me the most is nerve blocks. I get them every 2 weeks from my current headache specialist.
So my journey with non-surgical treatments with medication began right after my diagnosis. I was put on gabapentin 3 times a day, and that did work for a few weeks. That was very effective. That's how we knew it was TN. And I remember a few weeks in, I started getting super sharp jolt pain out of nowhere, and I talked to my primary care doctor, and she said, let's try carbamazepine. So we added that in twice a day. And then my neurologist also threw baclofen on top, which is a muscle relaxer, and I'd take that for if like an episode was coming on, if I felt it, or if I had a lot of tension squeezing in my face. And this whole cocktail of medicine was super helpful, but it came to a time where it just wasn't effective anymore, and the side effects from the medications, I didn't know which ones were making me so tired by 1 p.m. I just didn't feel like myself. Some days I couldn't drive because I felt so out of it.
Bianca said, "No success so far. I'm in constant pain 24/7. I just try to remain positive and take things easy. I'm an active college student and full-time recruiting admin, but my employer doesn't know about my condition. I haven't shared it with them because I don't want to be seen as a condition. I am much more than TN." Catherine said, "Non-surgical treatments helped for a short time. Medication helped for a while." Sydney said, "I have had some success with medications to treat my pain. It was a huge trial and error process to find what worked for me, and I still experience pain. However, my pain intensity and frequency has reduced." Mandy said, "I have had decent success with medications, supplements, and most importantly, diet as well. I've recently had good success with transcranial magnetic stimulation, which has been the most helpful treatment for me to date. I also have found success in auricular acupuncture as well." Elma said, "I started with medications. They worked, but I had to keep increasing my dosage. I maxed my dosage, so I looked for natural ways. I tried medical marijuana, but I mixed it with medication and I got pretty high and didn't like it. It scared the crap out of me. I tried vitamins from doTERRA LLV pack, and that did the job. I've added some supplements and changed my diet and tried to keep my stress levels low." Marvis said, "The rheumatologist gave me a prescription for a high dose of gabapentin to take when I got home and referred me to a neurologist. She was too slow. I had to wait 6 months to a year. I was referred to another that changed me to a low dose of oxcarbazepine."
I've just done medications and I did a nerve block. So of course the most common med for this that people are prescribed of carbamazepine, I am allergic to. And I've been on so many anti-seizure meds because of migraines over the years that they're not really effective anymore. So kind of kept trial and error for a long time, which basically has ended up with me on quite a few meds, 3 times a day, and they're very strong and impact my, brain function of just slowing everything down. I get a ton of brain fog, which has been interesting to deal with over the last few years. And the nerve block, it was way worse. Was it sphenocapital? Goes up through and into your sinuses and then drops some anesthetic there, and it was not effective and ended up with me curled up in a ball, just shaking.